Hi, my name's John Rippentrop, and I'm here to tell you a little bit about the UROLIFT procedure and kind of what to expect on the day of the procedure. The day of the procedure will give you some directions about what medications to take and what medications not to take. That will include whatever anticoagulation you may or may not be taking. You will likely be prescribed an antibiotic as well, and so make sure that you get that picked up in advance. We will have some information sheets about where to pick that up, as well as some over-the-counter medications that will assist you after the procedure is done. When you arrive, you're more than welcome to drive yourself, although having a driver is often nice just to have some support. We'll get you back to the room where one of our nurses will make sure we get you all set up as comfortably as possible to get the procedure done efficiently and with as much dignity as we can, knowing it's a very sensitive area. We'll make sure we get the area numbed up, meaning that we'll use some numbing jelly within the penis itself so that your sensation is decreased. Most people elect to use nitrous oxide or laughing gas during the procedure. This just makes it more tolerable. You'll still be awake, you'll still be able to communicate, but you'll just be a lot more relaxed. Once we make sure that's up to a good level, we'll get started with the procedure. The thing that you'll notice during the procedure, which takes about 7 or 8 minutes to do, is that you're going to have a sense of urgency or frequency. You're going to feel like you need to go to the bathroom. I'm aware of that as we're doing the procedure. As we have the camera in there and we're deploying the device to make sure that we're getting it in the right spot, we'll be filling your bladder up, and then we'll empty your bladder out again. Typically, we're going to use anywhere between 4 and 7 devices, and so that process will fill your bladder up 4 or 7 times, depending on how many we need, depending on what your prostate looks like. We get to tailor the procedure to each individual as to what their prostate needs to hopefully provide them a good channel in order to urinate. Most guys will not need to go home with a catheter afterwards unless we discuss that in advance, or occasionally if you're unable to go to the bathroom afterwards. Doesn't mean the procedure didn't work. It just means in that moment you weren't able to go. That's fine. We'll get that figured out at the time on how to get that catheter out. Usually that's just going to stay in overnight. During the first couple of days afterwards, you will have a lot more urgency and frequency than what you maybe did even before the procedure, and that's completely normal. And that's an important point. That urgency, that frequency is normal. It will get better. The blood in your urine also will get better. So during those first few days afterwards, you're going to want to keep your activity to a minimum. You're going to want to make sure that you're staying hydrated. There's some over-the-counter medication called AZO, and that will be included in your handout before the procedure is scheduled, that you can pick up that will help a little bit with that urgency and frequency. What you'll realize starting about day 3, day 4, is that urgency and frequency seems to be getting better, and with that, your stream is also getting better. During those first 2 weeks afterwards, I don't have a lot of expectations about where you're going to end up in terms of your urination. We're just still in the recovery phase. We typically check back with you within the first couple to 3 weeks afterwards, as well as a couple to 3 months afterwards to make sure we're headed in the right trajectory. In terms of the prostate medication that you may be taking around the time of the procedure, usually we're going to keep you on that medication until such time that we meet afterwards to stop it, unless we've decided something in advance. So if you have a question about it, just keep taking the medication until you see us, and then we'll figure it out from there. Most of the time, we don't send you home with any additional medications afterwards. Sometimes we may change our mind on that, but most of the time there's not anything to pick up at the pharmacy. Hopefully, this type of video will help you have an idea of what to expect the day of the procedure, give you a little bit of reassurance that we know what we're doing and we're going to take good care of you. And certainly if there's questions that this doesn't answer, give us a call, but we're here to help.